So what about that coccyx dysfunction? A lot of women have problems with coccyx after childbirth. Sometimes it likes to break backward, which is really not much of a problem when it goes backward. This joint right here, this sacrococcygial joint, is it's a synovial joint, and it's supposed to have movement. There are 3 or 4 tiny little bones that are part of the coccyx, and when you sit down, the coccyx is supposed to flex forward. This joint's supposed to be mobile, but very commonly it gets osteoarthritic and does not want to flex forward when you sit. The biggest problem that I see in my practice, sometimes toddlers, when they're young, they will fall on a step and it will start to hook this coccyx, and it'll get stuck there like that in what's called a hook coccyx. Very commonly you'll see a hook coccyx co-present with a left side shift. In other words, left side bent coccyx and hook too. That's what I see more, and I have no idea why it goes to the left more than to the right. That's what I see in my practice more. You got to get that out of there somehow. And so there are several good techniques for doing it. Of course, the sacrotuberous ligaments, sacrospinus ligaments have to be released, and I'll show you how to do that. And then we have to get in here and do some muscles that people do not appreciate much, and that's sacrococcygial, the lateral sacrococcygial muscle, the medial sacrococcygial muscle, and of course you got another lateral one on the outside. Then you got these pubooccygial muscles that come here and form the pelvic floor. They come up here and all attached to form a container for the pelvic floor. All that stuff is important. In women that are having pelvic floor dysfunction, this stuff has all got to be fixed. So here's some very basic technique for dealing with coccyx dysfunction and or pelvic floor dysfunction. I'm going to leave this coccyx sitting up here if that's okay with you, Michelle. What I'm going to do is I'm going to come in here first of all and come across where the sacrotuberous ligaments are going to be right in here. So I'm going to come off the coccyx and come across and just feel for tension in the sacrotuberous sacrospinous ligament. You guys have done this technique. We've been teaching this for a long time. Everybody teaches sacrotuberous work, so I'm not going to spend much time on that. I just want you to know that you need to come under that first. Come under it and lift all that tissue up. You're trying to lift that whole thing up. Of course, you've evaluated for the coccyx, and you have to come down on the, first of all, make sure you've got a hook coccyx. If you cannot feel the tip of the coccyx, you've got coccyx dysfunction. And Michelle's got a little bit of a hook coccyx here. We're going to try to get this out of here. So one of the things I want to do is I want to check to see if it's side bent to one side or another. So I'll come on this side with fingertips on her left side and try to see if I can tell if it's side bent. And in fact, she is a left side bent coccyx. Got more room here on the right. When I come over here, she's got more room, but when I get over here, not as much room on this side. Okay? So I'm going to be wanting to deal with this side. There's a lot of ways to do it. Actually, Jerry Hesh has a technique I'm going to steal from him that's very good, but right now I'm going to teach you the ones that work best for me. And that is, I'm going to come under as much as I can and start working on the sacrococcygial ligaments first. So I'm going to come in right like this and under as much as I can. I'm always trying to work under because I'm wanting to release the tissue that's binding it down forward. So I'm coming in, and always make sure that you're cool. You tell your person on the table exactly what you're doing. You ask their permission, and always do it through underwear or clothing or a sheet of some kind. Work on the air of modesty. Okay, so now I'm going to ask you to pelvic tilt so I can feel where I am in there. Make sure that I'm on the sacrococcygial ligaments and a little bit of that pubooccygial big old complex there. And then I'm going to glide my finger over and try to push that coccyx into right side bending. I'm in pretty good position here. Okay, now I feel like I'm able to get under. Right now I'm under the tip of her coccyx. I couldn't get under there before. So this is good. I'm going to take a compressive force right now and put it right here to push that sacrum up so that I can get under that coccyx. And now you just tell me if this is okay. That can be very tender down there. Remember, the filament terminale ends, that's the end of the spinal cord. The spinal cord actually doesn't end at S2. It comes down through tiny strands at the filament terminale that runs all the way down to the tip of the coccyx. When it's hooked, the theory is that it can cause tractioning on the dural membrane and can cause all sorts of weird dysfunctions that can end in migraine headaches and all sorts of other weird psycho-emotional type problems. Okay, so I'm starting to get a release in there. So as soon as I get a release, I slowly come out and release that tissue and I rock around here. Take some of that. That can be a little bit painful, so you just kind of desensitize some of the mechanoreceptors by doing this. Give this thing a try. Check it on all of your women that are having premenstrual syndrome problems that will not go away. If they're having migraines, don't just stay up there at the head. Check that dural membrane connection all the way down through the filament terminale and through the coccyx, okay? Michelle, let's get up and see how you feel after that coccyx got dehooked, if that's a word. You okay, girl?
Yeah, no, that felt great.
Have you ever had trouble with that coccyx before?
I have actually. A long time ago, I did a nice split on the pool, one leg inside the pool, one leg outside. And that's exactly where I got all the impact. So as soon as you did that, my whole body just, I could feel it go right
lift. Yeah. That nervous system changes. It definitely changes nervous system. Appreciate you on that.
Thank you so much.
Thank you.